Dr. Stein, every dentist, when they talk about gum disease, starting with little bleeding, I think you guys call that gingivitis, going to advanced periodontal disease, and really kind of, heavy bleeding and gum loss and bone loss and, of course, tooth loss. So most dentists, kind of like say you got to get your gum disease under control, you got to floss, you got to do the things, and you got to go and do sometimes more than just a cleaning and, a little gum surgery or a little deep scale cleaning, which is not quite as extensive as a gum surgery, because you're losing your teeth. Now, I'm sitting here and I go, okay, losing your teeth is a bad thing. But we talked quite a bit that there is implants, there's all kinds of ways to actually put the teeth back. Sure, you have to spend money, and that's not a good thing, but you can put them back. While this is going on, your mouth probably doesn't look so good. But wouldn't the infection which is in the mouth, the gum infection, that yellow, reddish, ugly pus, which is right there in your teeth, and which is at the gateway of your blood vessels, and which goes into your blood faster than anywhere else in the body, wouldn't that poison the body on a minute-by-minute basis? And wouldn't that be more devastating to liver, kidney, heart, brain, the blood circulation, just about anything?
Yes, it is. There is a definite link between gum disease and to have a constant irritation of the gums to heart disease and to different diseases. The teeth are not separate from the body, so there is. It's important to we can't look at a person's teeth as being not part of the body. So neglecting your mouth is also neglecting your health, and it's so important because the mouth is an area where with different types of bacteria that live there that cause a lot of inflammation, that we keep that part of the body very healthy. So keeping that's why gingivitis and inflammation. Okay, it's important that we take care of the mouth, and that we do this. We start off with the 6-month cleanings, and then just to preserve the health of the gums, so that it doesn't progress to other organ systems.
Right, because would you agree a little bit or lots with me that losing your teeth is of course a bad situation, and you explained well that you get your bone shrinking, you start looking old, you obviously need to spend a truckload of money to fix it and all that type of stuff. But how can you put a price on ruining and poisoning your liver and stuff, and getting that must be bringing your immune system down. If all your internal health soldiers, if we want to call them that, they have to try to make sure that they fight this infection in the mouth. Some dentists have told me that the infection in the mouth is as big as your hand. Who would run around with an infection on your stomach, on your chest, on your arm, in your face, as big as your hand, and not go to a doctor? Who would do that?
Right. Yes, I don't know, but unfortunately people have such a fear of dentists sometimes that they think in many cases it can be not painful until it reaches a point that people wait too long, and then you start losing teeth. But you're right, to walk around with constant infection is just a terrible thing, and then it just leads to other organ failures down the line. So it's so important that people do come and treat everything early rather than waiting until it reaches a point where it's
right. Like they have information out there that a pregnant woman get premature babies underweight if they have gum disease.
Yes.
Yes,
that's cool.
So if that can happen, which is a pretty drastic thing, what about the everyday flu which comes once or twice a year to people if their immune system is not good?
Yes, it can affect anything that, it can lower the body's immunity to have a constant irritation, whether it's in the mouth or somewhere else, but it definitely does lower the immune system.
An infection is an infection is an infection. It doesn't matter where you have it.
Right.
Right. Well, maybe I should end up this visit and this video and go to my dentist and check whether I have an infection.
Yes.
Because definitely looks that wouldn't be a good thing. Dr. Stein, thanks a lot for the information.
Okay.
And let's hope that the video encourages some people to take care of their infection and, maybe they get rid of chronic fatigue. They don't know where the heck it comes from. It's because they have infections in their mouth. It wears them out and they don't even know it.
Yes. Right. Yes.
Thanks a lot, Dr. Stein. Bye-bye.
Okay, thank you. Bye now.